Hi, Facebook. It's 8. It's Wednesday night. We're going to get this thing going. All right, I'll try that again. Facebook, it's 8 o'clock. It's Wednesday night, and we're going to get this thing going here very quickly. Got a lot of information as usual to cover. I'm going to call this my holiday Santa edition, trying to feel festive since we only have a few more days before Christmas. So like I said, lots to cover. My goal is to wrap up by 8:30 as usual. I'm actually going to recommend that if you've got another 30 minutes after you're done listening here, that you head over to Hoosier COVID-19 update. This is a pulmonologist that runs that Facebook page. If any of you have been following him, he puts out about 3 posts a week. They're fantastic, always lots of really good information, usually humorous. And he is doing his first ever Facebook Live tonight at 8:30 on his page. He'll be also talking about vaccines, and I believe he actually got his first dose of the vaccine today. So he'll be able to kind of talk to us and update us about that. So I'm going to start by going over some of the most up-to-date numbers. This is straight from a call with hospital officials earlier today. So there are 60 patients that are currently admitted at Ball. Um, there are 10 of them in the ICU. They have 5 patients admitted at Blackford, 5 patients admitted at Jay County. And the good news was that they actually had 12 patients successfully discharged today, so that's always a lot of good news to celebrate. There were no deaths in the hospital either, always good news. They mentioned that there is a lot of ongoing surge planning and process, but it does seem like maybe, fingers crossed, that we might be seeing a plateau in terms of the overall cases. We are definitely seeing a plateau in hospitalizations, but as does tend to lag, deaths are still increasing, and COVID-19 is still the #1 cause of death in Indiana. So that is overall not good news. Um, you may know that vaccines are starting, that Indiana has received doses, and Ball is supposed to get its shipment of vaccines tomorrow afternoon. Assuming that everything starts going to plan, they're going to start vaccinating local healthcare workers on Friday morning. So they apparently sent out emails over the weekend, which went to mostly physicians. There was a link provided by the State Department of Health to sign up at the local hospital. The very first line underneath this email said, "Do not forward to anyone. This link is meant to be specifically for the person it was sent to." What did everybody do? They forwarded the link. So there was apparently a lot of chaos in the last couple of days with lots of people wanting to schedule the vaccine that weren't healthcare workers. So they've been kind of working through that. I will say that for some reason my number was drawn, and I was one of the people to officially get an email from the State Department of Health. So turns out I'm going to be one of the very first people vaccinated on Friday morning at the hospital, 7:30 a.m. So my plan is to try to document this as well as I can. I don't know if they'll let me take a video, if they'll let me take photos, but I plan to take some videos over the course of 42 to 72 hours after 48 to 72 hours after I get the vaccine, and post those to our stories on our office page. I'll probably post some type of a summary video as well, just kind of documenting how I'm feeling, if I have any injection site reactions or fever or whatever, just so that you guys know that I'm not going to turn into a mutant, and so give you a better idea of what you might be able to expect. So, with that being said, lots to cover on the vaccine. A little bit will be repeat from what we talked about a few weeks ago, but probably a good idea to explain it again so that everybody is on the same page. So, we're going to talk about mRNA vaccines, and specifically the Pfizer and Moderna vaccine. That's what everybody cares about right now. So a lot of people are worried that these vaccines were rushed, that they happen too quickly, that there's no possible way that they can be safe and that we can know that they work. Well, turns out that they were actually investigating messenger mRNA vaccines for a good 15 years before they actually started putting them into play this year. So we had the technology that was there. China actually sent us the genetic sequence of the virus back in January. And what I've read is that it only took them 2 days to find the sequence that they needed for the spike protein that is on the coronavirus. The spike protein is what allows the virus to actually enter cells. If we block the spike protein, then we block the virus from entering cells. It can't replicate, therefore it can't cause disease, and you can't get sick. So obviously, all good things. The the science behind it is actually pretty amazing. What happens is that the messenger RNA comes in through the vaccine. It's carried by something called lipoproteins, which actually, independent of the messenger RNA themselves, can cause you to have a low-grade fever, even if the messenger RNA wasn't included. And so it carries in the lipoprotein so that the messenger RNA can get into our own cells, which are lipophilic, meaning that they like fat, or they're fat soluble. Once the mRNA gets into our cells take it up, they start transcribing it, and they make that spike protein on the virus. Then your body starts to recognize that spike protein as being foreign. Your body starts immediately making antibodies and activating something called T cells, and you're a go. Really, truly amazing, the technology behind this, and I think you're going to see a lot more with messenger RNA and vaccines and gene delivery in the future. A few questions about getting 2 doses of the vaccine. Larry, I did not find that there was anything on only 1 dose of the Moderna vaccine being effective. If you have information on that, send it to me in a message through our office page. But right now, it's looking like we're going to need 2 doses of either the Pfizer or the Moderna. In the studies, you had about 50% immunity after getting the first dose, which waned a little bit in the few weeks following, but then revved up to what we think of as being about 94% immunity after receiving the second dose. So you are not felt to be fully immune to the best of the vaccine's capabilities until about 7 to 10 days after the second dose. So this is really important when it comes to, making any type of plans or visitation or getting together with people. And in general, it's felt that, we're going to be stuck with these masks for a long time until we know for sure whether or not the virus actually reduces transmissibility. In terms of the numbers of cases, with the Pfizer vaccine, there were 162 cases in the group that got placebo. There were only 8 cases in the vaccination group, and there was only 1 severe case in the vaccination group. And so, your goal here is hopefully to prevent people from getting it at all, but most importantly, to prevent them from getting severe illnesses that might require hospitalization or that could lead to death. And the Moderna vaccine actually showed that there were no severe cases. The difference was 185 in the placebo versus 11 in the vaccination group. So, very, very, very good efficacy. And people are going to digest this and nitpick at it. Oh, well, which one should I get? Well, you're probably not going to have a choice. And that's good news because they're both very effective. So don't try to overthink it. Just get whichever one is available to you at the time that it is offered. For me, that should be the Pfizer vaccine, and I will take it willingly. I would take it in my eye. I would take it in my butt. I would take it wherever it had to go in order to prevent this illness. And so some questions about, are you still going to be able to transmit the virus? And that's possible. Unfortunately, we know that a lot of people can be asymptomatic carriers and can shed the virus and can infect other people. And that may be the case after you're vaccinated. We just don't have enough information. That's why the masks are still going to be very important. It was very reassuring that with the Moderna trial, they actually could not find evidence of the virus being shed in the nose of people who had received the Moderna vaccine. So it's promising, but we don't have enough data yet to know for sure. A lot of people with questions on side effects, reactions, should I get it if I've had this, if I've had X? And so I'll try to go through that briefly. The most common side effects reported with the vaccines, which seem to be more in the Moderna vaccine, like 80% of people had an injection site reaction of some kind, mostly arm pain. Um, and that's how a lot of the people who were in the clinical trials could tell that they probably got the vaccine versus placebo. So that turned out to be true. There's also joint and muscle pain, headaches. You could have a low grade fever. Overall, these reactions were very minor. Now, you've probably heard a little bit about the a possibility of anaphylaxis, and especially after a few people developed anaphylaxis in Europe. These were patients who had a history of severe allergies in the past that had previously required an EpiPen. Um, this was actually not seen in the studies, and for the most part, per like the CDC recommendations and what IU Health has said that they are doing, is that if you have had prior anaphylaxis, so low blood pressure, basically a shock-like state, mouth swollen, trouble breathing, where you've had to use an EpiPen or be hospitalized, right now they're saying you should hold off on getting the vaccine, especially if that reaction was from a prior vaccine or from any type of a medication. Um, but that's anaphylaxis. That's not necessarily a side effect. That's not a rash. That's not nausea or stomach related side effects. We're talking true anaphylaxis. That's the only people that they're saying right now should maybe hold off until we have a little bit more information. They're also recommending that we maybe wait 15 minutes or so after the administration of the vaccine to monitor for any potential reactions. Although I have been told that some hospitals have decided that's optional. So to be continued. I don't know if I'm going to have to wait to be monitored on Friday morning or not. The other thing that you may see come up is something called Bell's palsy. This has been gathering attention in the news. Bell's palsy is temporary facial paralysis on one side of the face. Sounds terrifying, but it's actually a relatively common condition in the general population. And so what they saw in the trials was that I think 4 people total had Bell's palsy. They happened to all be in the vaccination group. And there were none in the placebo. However, when you actually look at the rates of Bell's palsy compared to the general population, they were felt to be equivalent. So they really couldn't link that was a definite trigger. It's also well known that viruses themselves cause Bell's palsy. And you have a much higher risk of getting Bell's palsy if you get the flu or any other viruses, including the coronavirus. And so for me, that's still a win-win. You take the vaccine. Some other like common myths that are associated with the vaccine that I've seen circulating on the internet, and everybody who's taking the time to watch this video tonight, you had the opportunity to educate other people about what we've talked about tonight, what our Facebook page, places that would be good sources of information, and you don't, I think, realize, each of you, what the power you have to influence others. And I think the more positive reinforcement we can give our community about giving the vaccine, receiving the vaccine, having enthusiasm about that, believing in the science, et cetera, it really does go a long way. Versus if I were to say, I'm not sure, I may not get it, that has the potential to impact everybody that I talk to. But even as non-physicians, you all can do that as well. So spreading good quality scientific information is really important. Things that people may say to you and you can say, nope, not true. Number 1, does not alter DNA, period. Virus doesn't alter your own DNA. End of story. Messenger RNA itself is a very unstable molecule and actually needs to be, frozen at very high temperatures before it can be administered. Once it gets into the body, any messenger RNA that's not taken up by the cells is almost immediately degraded. And messenger RNA cannot turn into your cell's DNA or alter the sequence in any form. Lots of questions about pregnant women, lactating women. They were excluded from the clinical trials for obvious reasons. However, it's felt to be a very low risk scenario giving the vaccine, and we know for sure that having COVID during pregnancy is much higher risk for developing COVID related complications. So As of right now, it's a choice between the pregnant woman and talking to whoever is administering the vaccine. If I were me, if I were pregnant, or if I was still breastfeeding, then I would be willing to take that risk and take the vaccine. But we don't have any data about that. The other thing related to pregnancy is that getting the coronavirus vaccine may cause infertility, that it could interfere with the binding of and things on the placenta. Not true. This was terrible misinformation that's been propagated on the internet. We've got lots and lots of women, unfortunately, who've been infected with COVID, who have been still able to get pregnant. So if you can still become pregnant after actually having the virus, that whole scenario just doesn't make any sense. The vaccine itself cannot give you COVID. So everybody always says that you can get flu from the flu shot. That's also not true, in case you were wondering. But you definitely cannot get COVID from the vaccine. The vaccine only codes for the protein that's on the virus. It doesn't cause for the virus itself. So you can't get COVID. Lots of questions about, will we need repeat dosing? Will we need annual dosing? And unfortunately, it's looking like that's probably going to be the case. We don't know for sure. There's going to be a nauseating amount of detail coming out about this in the next year or so. There's always a possibility that the virus can mutate, in which case it's very easy to insert another strain of messenger RNA into a new vaccine. I would not be surprised if we end up needing an annual booster for this, kind of like the flu shot, that has different strains of the virus in it. Still lots to be determined about that. Are we going to need one as early as next fall? Don't know. Not for sure. Also, can you get the vaccine if you have previously had a COVID infection? And the answer to that is yes. We think obviously that you get some immunity from having had COVID, but we don't know how long that lasts. An estimate is 90 days, could be shorter, could be longer. Due to short supply of the vaccine, they are asking that by the time your number is called to get it, if you have had a COVID illness within the previous 90 days, that you maybe consider waiting. But that's not a definite recommendation, and it's very reasonable to go ahead and go forward. But that would be where you may make the altruistic decision to let some other people go in front of you before that 90 days is up. But if you had an infection back in the summer, something like that, you definitely want to jump on board as soon as it's available. So many questions that we're getting in the office and on the Facebook page about distribution. And I truly, truly, truly wish that I had more answers for you as to how we're going to roll this out to the community. Unfortunately, those answers have not been provided to us. What has been proposed is that this phase one, includes healthcare workers, nursing home, long-term care, assisted living residents, essential workers, and then also adults over the age of 65. What they are calling medical comorbidities that are of the highest risk include the following: obesity, diabetes, COPD, any heart condition, chronic kidney disease, cancer, organ transplant, or sickle cell. As you can imagine, that is a very, very, very large amount of people that are clearly not going to be able to be vaccinated right away. Based upon the number of COVID vaccines that are going to be available, we should be able to, with needing 2 doses, get 150 million people, about a little less than half of our population by the end of spring, early summer, assuming that everything goes according to plan. So there's no reason to think that that's not going to include every high-risk individual, and even working on down the line as soon as it's available. I know for sure that the hospital is going to be involved in distribution as they are with healthcare workers. That's because they're really the only place that has the big deep freezer -90 to be able to store the Pfizer vaccine. But the Moderna vaccine can be refrigerated for long periods of time, which means that a place like our office would be able to store it and distribute it. I hope so much that that's going to be able to happen, but we Still at this point, just don't have enough information to know if that's going to be a possibility. We don't know if they're going to decide, by age or alphabetical order or signups. I wish I could tell you that for sure. I promise you, though, that we will make sure that we provide you the most up to date information that we can via these live videos or via our Facebook page. We will update the voicemail. We'll send out messages through our portal. Once we have that information, we will pass it along to you so that hopefully you're not learning it firsthand, on the news. But still lots to be determined. The good news is that there is no cost to the to the vaccine. You're not going to have to pay for it. They will ask for your insurance information, mostly to bill for the administration of the vaccine, which is universally covered by healthcare plans. Yeah, the good news is that the vaccine was fully funded by the government, and so there will be no actual cost to any patients. Overall, like I was mentioning earlier, the main goal of the vaccine is to help achieve herd immunity. And this is what we try to do with the flu every year, where we hope to vaccinate enough members of the community, or in this case, they also develop some immunity by acquiring the infection naturally, so that if there are enough if you were to get COVID and there's enough people around you that have either had it or are vaccinated, the virus stops dead in its tracks. It has nowhere to go. And then we actually have the opportunity to employ contact tracing methods and use our public health resources, which have been basically impossible to do right now with the total number of cases that we have. Right now, the distribution of the vaccine is just being decided on a state-by-state basis. So I have quite a few patients who are lucky enough to be able to go spend the winter in Florida. Some of those questions revolve around, if I get the first dose in Indiana, can I get another dose in Florida? I hope so. I don't think you're going to have to be registered in the state. And, kind of like the shingles vaccine, you could get one dose here and you could get another dose in Florida. I have seen a couple of healthcare workers in other states that have already received the Pfizer vaccine, and they actually got a card, like a COVID administration card, and it had their first dose on it, and it was like an ID card that they could carry with them that showed proof of vaccination. So I imagine that this is going to be something that becomes very important in the future. Maybe for even things like flying and attending concerts and doing the social things that we want to be able to get back to safely. So a couple of other really good questions that came up were related to outpatient treatment options. If you have symptoms that are present but are not, bad enough to be hospitalized, what can we do to treat you? And I am reluctant to have to say that there's really still not a lot of options, really none that have been FDA approved. They actually have scaled back the treatment protocols in the hospital. They're only giving convalescent plasma now to as kind of a last-ditch effort, and by family or patient request due to overall lack of efficacy. And that's unfortunate, but it just hasn't really been proven to help increase survival. Same with remdesivir. With all the administration of that and follow-up data really hasn't shown that it's been as effective as we felt in the initial periods. The one thing that has been shown to be highly effective is the administration of dexamethasone, which is a very potent steroid. So they are giving that to hospitalized patients, I believe, even if they don't have low oxygen levels. As an outpatient, there's anecdotal evidence that supports the use of zinc, vitamin D, vitamin C. And these are, minuscule benefits at best, but unlikely to be harmful. If you do become diagnosed with a COVID-19, I recommend having a pulse ox so that you can safely monitor your oxygen at home, monitoring for signs of dehydration, confusion, such as, being altered, not knowing where you are, having family members that are questioning your mental state. That would be a reason to go to the hospital other than shortness of breath. If your urine became dark, if you are older over 65 with a lot of medical conditions and you've got fevers over 102, that might be a good reason to be evaluated in the emergency room. Um, and really looking out for any concurrent pneumonia. So if you develop a productive cough, if you felt like you initially got better from the virus but then got worse again and developed a productive cough, you had no appetite, those can be signs of pneumonia. Those would be reasons to notify us. And in general, it's a good idea once you're diagnosed to try to keep in touch, with your doctor, or your nurse practitioner, whoever that may be, on a daily to every other day basis so that we're aware of what your health status is. The one thing that I'm just going to stress again is that how important it is if you are sick for reasons other than COVID that might be emergent and you may need to go to the hospital, go. I've had too many people that have delayed care because they were worried about getting sick when they were hospitalized. And I promise you, the hospital is one of the safer places that you can be because of people wearing masks and taking the appropriate precautions. So if you think you might be having a stroke, if you think you could be having a heart attack, you're having severe abdominal pain, please, 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 please don't delay getting the urgent care that you need and being worried about the coronavirus. The last question that we had was how long can you test positive for COVID? I think it can be weeks, like up to 10 to 12 weeks, but that's only in select individuals. I'm keeping an eye on the time, and I've just got a couple minutes, but the CDC changed their they updated their quarantine guidelines mostly to make it easier for people to follow instructions. So the virus incubation period could still be up to 14 days. So if you know you've been exposed to COVID and you're not in a position where you absolutely have to go to work because you're the sole provider for your family, or you're considered an essential worker, if it's okay for you to be at home in quarantine for 14 days, I still strongly encourage you to do that. However, there are two strategies that can shorten your quarantine. One is a negative test. So the CD says that if you're exposed and you have a negative test, that you only need to quarantine for 7 days afterwards, or that if you do not do a test, your quarantine should be for 10 days. Lots of questions about what the timing of that test should be. I don't know that I would recommend being tested on the day after you were exposed. I would probably wait until at least 3 to 4 days later. That way, right now, testing is taking between 2 to 4 days to come back. So by the time you got your negative test, that would be about day 7. But again, it just really depends on the type of environment that you're in. I saw some updates that said that, right now, if you were to gather in a group of as low as 8 to 10 people, that there could be a probability of somebody there having COVID of 75% or greater, based upon the Indiana numbers, which is really terrifying. And that will bring me to my very last topic of conversation, which is going to be Christmas. I know that Thanksgiving was really hard for a lot of people, and it was difficult to not spend Thanksgiving with our families, but Christmas is going to be no exception. Still very, very, very high rates of community spread. Very risky to be in larger groups without wearing masks. And I just strongly recommend that you try to make it a virtual gathering as much as possible. Keep everybody safe. Maybe even plan for a Christmas in July when we can all celebrate warm weather and being outside and just do something different for 2021. When I very first logged on, I mentioned that at 8:30 tonight, which is in about 1 minute, Hoosier COVID-19, who's a pulmonologist who does his own Facebook page, multiple updates per week, is also going to be doing a Facebook Live. He got the vaccine today. He's going to be talking about that, as well as his take on some updates with the vaccine. So if you haven't had enough COVID talk and you would like to hear some more information, then I recommend that you head on over and check out his live video, and definitely follow him if you're not already doing that. So I probably won't see you all before Christmas. So I wish you a very wonderful holiday, a very safe holiday. We'll be back in January to give you some updates, hopefully with more information on the vaccine. Merry Christmas. Mwah.